present presentation is going to take care of the skull and the cranium in particular. Our permanent and principal rule in learning anatomy is that we have to realize that anatomy is a visual descriptive science, something we should never forget. That is why it is repeated in every presentation. This presentation, you must contribute to the knowledge you are getting from this course. So it is important that you take notes of what I'm going to tell you to write. So please prepare a piece of paper and a pen and contribute to your knowledge. This is an overview of the skull, and the skull has special features. What are these features? They are, number one, the bones of the skull are joined together by immovable fibrous tissue joint called sutures. Then some of the skull bones have paranasal sinuses. Paranasal means around the nose, and they open into the nose, and sinuses, they are cavities. They are in fact extensions of the nasal cavity into the thick parts of the bones of the skull. And then we have fontanelles. We will be talking about fontanelles very shortly. Now, the skull is divided into two parts, the face and the cranium. The face has 4 openings that will lead to 4 cavities. The 4 openings are the 2 orbits containing the eyes, the cavity of the nose, and the cavity of the mouth. And the facial bones are the nasal bones, lacrimal bones, palatine bones, inferior nasal concha. These are bony prominences on the inside of the nose. The vomer, a bone that contributes to the nasal septum. The maxilla, the center of all facial bones, and the zygomatic bone making the cheeks. Now, the mandible is not part of the skull. Why it is not part of the skull? It is attached to the skull by a synovial joint. Now, all bones of the skull are joined together by sutures, fibrous immovable joints, but the mandible is attached to the skull by a synovial joint. Therefore it is not part of the skull, but it is attached to the skull. Then we will go to the cranium. What is a cranium? Cranium is the vault or the case that contains the brain. So any bone covers any part of the brain is called cranial bone. Now, the inside of the skull is divided into 3 cranial fossae. They contain the brain, and they are 3. One is anterior, one is middle, and one is posterior. Now, what are the cranial bones? We have the frontal, the parietal, the temporal bones, the occipital bone, the sphenoid bone. The sphenoid bone is a very important bone because it makes the center of the cranial bones, and it articulates with almost every bone in the cranium. And then we have the ethmoid bone. The ethmoid here is an image telling me that the skull is made of two parts: the facial bones that have no relation to covering any part of the brain, and then the cranium, the bones that are covering the brain. Here is what a suture is made of. Here is a bone, and here is the other, and you can see that in this area there is a joint which is tortuous. It's not a straight line, and the area between the two bones is occupied by dense fibrous tissue connecting the bones, and because it is dense fibrous tissue, the bones are immobile. They do not move on each other, and this is what is special about bones of the skull, except the joint between the mandible and the skull. What can we see here? Let's analyze the situation. There is a suture line or a suture joint between these two bones, and these bones are flat bones, so you can see there is a dense outer compact bone on one side or on the outside, and a dense compact bone on the inside, and in between we have spongy bone. It's called the table of the skull bone. When we were addressing types of bones, we found that we have long bones, thin bones, irregular bones. Now, the long bones especially start as a model of cartilage. Then what happens? Blood vessels come in, and it starts the process of ossification, that is changing cartilage into bone, and the process is going to expand, and this is called primary ossification center. Now, in case of the skull, what are the types of the cranial bones covering the brain? The answer is that mostly they are flat, thin bones. Now, what is their starting point? Is it a cartilage or a membrane? The answer is a fibrous membrane. And this fibrous membrane, when is invaded by a blood vessel, the process of ossification is going to start usually in the middle, and the process of ossification is going to expand along the way, and is going to reach the next bone. Now, the next bone also has a primary center of ossification in a membrane, and the process of ossification is going to expand. This is going to take time. So ossification of one bone is going to reach the ossification of the other bone, and they are going to unite by a suture. This is going to be happening in different durations in different bones. Now, at certain point of time, ossification is not happening in certain areas. What are these areas then going to be made of? They are going to be made of a fibrous membrane, and this process, which is still made of fibrous membrane, not ossified, is called a fontanelle. A fontanelle is going to be between bones. Now, this fibrous membrane is going to be ossified later on in life, and we have several fontanelles, like the two lateral ones, the Sphenoid Fontanelle and the Mastoid Fontanelle, and there is a posterior fontanelle in the middle. The most important one is the Anterior Fontanelle. This fontanelle is going to be closed by the process of ossification by the age of 18 months. That is 1.5 years. Therefore, if you see a child whose age is less than 1.5 years, you put your hand on the head and you can see that there is a soft area. This is the anterior fontanelle. What do we see here? We see different views of a skull of a very young baby, where we can see the ossified part of the bones, and we can see as well the still not ossified membrane. These are called fontanelles, and there are several fontanelles in the skull of a young person, and these unossified membrane are called fontanelles, and the most important and the latest fontanelle to close is the anterior fontanelle. This is a mind map of the special features of the skull, and the first one was sutures, and we talked about sutures. Now, when we look at the arm that says fontanelles, now you can read this mind map as I have trained you how to do that, and you can see that there are so many basic information about fontanelles. For example, let's go and follow the arm that says the constantly found fontanelles. Number 1 is the anterior fontanelle. Where is the anterior fontanelle? It is in the midline between two parietal bones and the frontal bone. This anterior fontanelle is the latest to fuse or close at the age of 18 months. It is important landmark to do what? For the sake of examination of a child. Now, these fontanelles, they disappear later. How when they become bone, when the fibrous membrane becomes bone, when this process is going to happen soon after birth. The latest fontanelle to close is happening at the age of 18 months, and it is the anterior fontanelle. In this image we can see that there are different colored areas. These are sinuses. A sinus is an extension of the nasal cavity into the thick parts of the bones of the skull, probably to make them lighter in weight. Now, which bones have sinuses? We have the frontal bone has air sinus. We're going to see that in the next few slides. So there are frontal sinuses in frontal bone. There are ethmoid sinuses in ethmoid bone, and there are a pair of sinuses in the maxillary bone, one on the right and one on the left. And lastly, there is an air sinus in the sphenoid bone at the body of that bone. In the next few slides, we're going to see an anterior view of different nasal sinuses, and we have to address these sinuses because when they get inflamed, they hurt people in the form of facial pain. And these are the frontal sinuses, the ethmoid sinuses, the sphenoid air sinus, and the largest air sinus is the maxillary air sinuses. These are frequently inflamed and they cause trouble as facial pain. Which view of the skull is this? This is the frontal view. In Latin it is called norma frontalis. This line demarcates the cranial bones from the facial bones. So superior to the line is the cranium, inferior to the line is the face. And again, this is the face area, and the arrow is pointing at the mandible. The mandible is the lower jaw and is part of the face. But the question is it part of the skull? The answer is no, it is not part of the skull. Why is that? Because all bones of the skull are united by sutures, fibrous joints. The mandible is connected to the skull by a synovial joint, a different joint that allows free movement. Therefore, the mandible is part of the face and not part of the skull. You can write that in your notes. Again, we have to stress this fact. The mandible is a facial bone. and the mandible is not part of the skull for the reason we have just discussed. Now, the face has four holes, four big holes. We have two orbits. An orbit is a cavity in the face that is going to contain the eye and its related structures, and in the midline we have the nasal cavity, the beginning of the respiratory system, and we have lower down the oral cavity, the beginning of the digestive system. Do you know what the view of the skull is this? This is the norma verticalis, the vertical view, that is the superior view, and this is norma what? This is norma lateralis. We are going to study the skull from this view to have an idea about what are cranial bones and the facial bones. And this is the line dividing the skull into cranium and face. So this is the cranium and this is the face. This is a posterior view of the skull. It is one of the simple views of the skull, and this is called norma occipitalis. The first bone anteriorly belongs to the cranium, and because it is anterior, it is called the frontal bones. It starts as two bones, one right and one left, but they are fused very early. Therefore, it is more correct to call this bone the frontal bone. The green marked area is the lower part of the frontal bone, and it makes the margin of the orbit, and this is called the supraciliary arch. This is the starting point, and then going up is the frontal bone, the beginning of the cranium. This is a sagittal view of the skull, and when you look anteriorly at the very front part of the cranium made by the frontal bone, you can see a cavity inside the thick part of the frontal bone, and this is called the frontal air sinus. It is usually divided into compartments, therefore then it is going to be called frontal air sinuses. They open into the nose. This is a lateral view of the skull. The green marked bone is the frontal bone, and if we go posteriorly, we can see a suture between the frontal and the next bone, which is called the parietal, and because this suture is in the coronal plane, this is going to be called the coronal suture. And posterior to the frontal bone is the parietal bone, the bone that surrounds the lateral part of the cranium, therefore it is called parietal. Now this parietal bone, if you go down here, you can see that there is a suture between it and the bone inferior to it. This is called the temporal bone, and a suture between the parietal, the green colored bone, and the posterior bone, which is the occipital. And this is the parietal bone, and this is the occipital bone. The occipital bone is the most posterior bone, and it is the largest cranial bone, as we are going to find out a few slides later. The green colored bone in this lateral view of the skull is the temporal bone. Why is it called the temporal? Because when a person gets older, white hair grows in this area and tells the time or the age of the person. Therefore this is called the temporal bone. It is inferior to the parietal bone, and it is anterior to the occipital bone. The structure of the temporal bone that is marked green is called the mastoid process. This part is under the skin, and you can feel your mastoid process just posterior to the ear. Now you know where is the temporal bone, and if you go up, and you are going to find the parietal bone, and you can see this suture between this part of the temporal bone and the parietal bone. The temporal bone has several parts. There are parts that we can see now in the lateral view, and there are parts that we cannot see, which are inside the skull, and this part is called the squamous part, the thin part, and it articulates by a suture with the parietal bone, and therefore this suture is called squamous suture. At this stage of our knowledge, now we know that this is the temporal bone. Specifically, this is the thin part of the temporal bone called the squamous part, and when we go superiorly, we know that this is the parietal, and anteriorly this is the frontal bone. Now in between these bones we can find the green colored area. This is the greater wing of the sphenoid. In this lateral view of the skull, the green marked area is the area of meeting of the frontal, parietal, temporal, and part of the sphenoid bone. This area is called terion. You simply don't pronounce the P. This is a very important area because it is thin, and in this area an artery on the inside of the skull is called the middle meningeal artery, runs just deep to it, and because the bone here is very thin and the artery is just underneath it, any hit or a fall on the head is going to injure the middle meningeal artery and result into collection of blood inside the skull pressing on the brain. In this posterior view of the skull, we can see that the green marked area is made by parietal bone and the other side parietal bone, and the suture between these two bones, meaning the two parietal bones, is in the plane of the sagittal plane of the body, and therefore this suture is going to be called the sagittal suture. Now, inferior to the two parietals, looking from the back, and the most posterior bone of the cranium is the occipital bone. This occipital bone is the largest bone of the cranium, and the suture that is between the two parietals and the occipital represent the letter lambda in Latin. Therefore, the suture between two parietals and one occipital is called the lambdoid suture. Now, the sagittal suture, as it comes posteriorly, it divides into two arms and form the lambda, and this is the lambdoid suture. In the lambdoid suture, sometimes we can see bones that are small and several, and these are not constant, and they are called sutural bones. Which suture is marked green here? We can see that it is in the sagittal plane of the skull, therefore this is the sagittal suture. And posteriorly, as the sagittal suture is going to bifurcate into two limbs, it is going to form the lambdoid suture. In this superior view of the skull, which is called norma verticalis, we can see that the cover of the inside of the skull is called calvera. When the top of the skull is being removed, and that's the calvera, we can have a view of the inside of the skull, what is called the cranial view. Now, the green marked area is what is called the anterior cranial fossa, and it houses the frontal lobe of the brain. Posterior to the anterior cranial fossa, you will find this green marked area. It is the middle cranial fossa. The question is, are the anterior and the middle cranial fossae are at the same level? The answer is no. The middle cranial fossa is a little bit lower than the anterior. When we go more posterior, we will find the posterior cranial fossa marked green here. It is the largest cranial fossa, and what are the important features that we can see in this posterior cranial fossa? Firstly, it is mostly formed by a single bone, which is called the occipital bone, and included within this fossa is the largest foramen of the skull, which is called the Foramen Magnum, that transmits the upper end of the spinal cord coming from the brain. What is this view? This is the cranial view of the skull, exposing the cranial cavity. And what is this green marked structure? It is the cubriform plate of ethmoid. Now, you are supposed to know the parts of the ethmoid bone when you watched the YouTube film about the bones of the skull, and these are groups of holes that will transmit the olfactory nerve fibers. Next is, what are these two marked areas? The question is, are they related to the frontal bone? The answer is yes. Now, we have seen the frontal bones, but there are parts of the frontal bone that is not visible either anteriorly or laterally, and the structure underneath these two marked areas is the orbit, and this part of the frontal bone makes the roof of the orbit. Therefore, these two areas are called the orbital plates of the frontal bone. And the green marked stars is a structure that you are supposed to know by now. Now we want to discuss the most important bone forming the center of the cranial bones, and this is called the Sphenoid Bone. Now, the area marked green here is the body of the Sphenoid Bone. Sphenoid Bone articulates with almost all bones of the cranium. In this central part, which is called the body, the Sphenoid Bone is like a butterfly. It has a body, 2 wings and 2 legs. Extending from the body of the sphenoid anteriorly, you can see the 2 green marked areas. These are called the lesser wings of the sphenoid. Again, the parts of the sphenoid bone, the butterfly looking like bone. We have seen the lesser wings of the sphenoid in the anterior cranial fossa. This marked green colored structure is the greater wing of the sphenoid, and we can find 3 holes in it. We are not going to address these foramina, but the greater wing of the sphenoid is in the middle cranial fossa, making the medial part of the middle cranial fossa. In this sagittal view of the skull, the green marked area is an air sinus of the sphenoid bone. It is present in the thick body of the sphenoid bone, and it opens into the nasal cavity. Again, this is a sagittal view of the skull, where the parts of the sphenoid bone are marked green. Now, this is the lesser wing of the sphenoid, and this depression in the body of the sphenoid bone is what is called the sella turcica, where you can find the pituitary gland, and this is the sphenoid air sinus opening into the nose, and the lowest parts of the sphenoid bone are called pterygoid processes. We are not going to discuss these in this level. Now we know what structure is this. This is the greater wing of sphenoid. Now, in which cranial fossa are we? That we are in the middle cranial fossa, and this is what is completing the structures of the middle cranial fossa. It is the petrous part of the temporal bone, that we could not see from the lateral view. So the question is, what makes the floor of the middle cranial fossa? The answer is the greater wing of sphenoid plus the petrous part of the temporal bone. We had a look at this slide before, and it is the posterior cranial fossa, mostly made by the occipital bone, and it has the largest foramen in the skull. In this image I can see the cranial view of the skull, and in the posterior cranial fossa the green outlined structure is the foramen magnum, largest foramen in the skull, and it allows the spinal cord to continue down the spinal column originating from the brain. On the posterior surface of the occipital bone and under the skin, if you put your hand at the back of your head, you can feel an elevation at the middle part of the occipital bone. This is called the external occipital protuberance. This is the basal view of the skull. The basal view of the skull is rather having many structures, many foramina, and in this course we are not going to address the features of the base of the skull, but except these two egg-shaped structures called occipital condyles. These are the condyles that will sit on the atlas and makes the skull connected to the vertebral column, the upper part of the cervical region. This is the mind map of the occipital bone, and you can follow the lines and collect the basic information out of this mind map. For example, what are the internal features of the occipital bone? And then if you follow the lines, it says number 1, there is an internal occipital protuberance, just like the external one we have just seen. And number 2, it has 2 grooves. For what are these 2 grooves? They are for transverse venous sinuses. We are not going that deep in details of the cranial bones. We have just said that we are not going to address structures at the base of the skull, but just for curiosity and for the sake of completion of the details of the sphenoid bone, which is the central bone, the most important bone connecting all other bones of the cranium. It is like a butterfly. It has two wings and a body, and we have seen the body and the two wings. Now what remains is the legs. The legs are extending from the body down into the base of the skull. The green marked structures are the legs of the sphenoid bone, which are called the pterygoid processes. This is a part of the mind map of the sphenoid bone. I just want to stress the fact that in an overview of the sphenoid bone, is the key bone of the base of the skull. And why is it a key bone? Because it articulates with all cranial bones. So what if it articulates with all cranial bones? Because it holds them all together. In this slide and the next few slides, please go through the parts of the mind maps of the sphenoid bone and other bones, and now you should be able to read a mind map. Just follow the lines. Test your knowledge before others test you.